You know, being recognized by such a significant organization, how's that feel?
You know, being recognized by NCBW is pretty phenomenal. I've worked with them for years, known about them for a very long time. Our organizations are about the same age. Black Women's Health Imperative is 38 years old. So we've had a long history together. And the focus that they have, I think a lot of people don't realize just how critical it is to health.
Right.
So, for example, if income inequality disappeared tomorrow, if racial segregation ended tomorrow, so would health disparities. I mean, that's how closely intertwined they are. So the fact that I get to work with them and then they recognize the contributions of the Black Women's Health Imperative is really amazing and wonderful.
Yeah, I was fortunate to work with them on the vaccinations when they partnered with Walgreens and they were trying to get everybody knowledgeable about the vaccination and access locations and stuff like that. So what type of opportunities have you had to work with NCBW, you and your organization?
So we actually worked across the board on vaccine hesitancy, vaccine availability, but also rare disease, sickle cell, getting women into clinical research, clinical trials, increasing the pipeline of researchers of color, getting funding for those kinds of diseases and conditions that disproportionately impact Black women, Black people in particular, and also lending our voice together with policy. I mean, again, policy is critical. If you can imagine if you changed reimbursement at the hospital level to factor in race and ethnicity, Black maternal mortality rates would be cut in half. I mean, there's simple things like that. They're political, but with the voice and the power of NCBW, we get to talk to a whole lot of people across the country and in ways that, frankly, politicians aren't used to being talked to.
What type of questions are you getting from the general public when you're out and about that really hit home?
We get questions like, why? Why is maternal mortality so high? Why do Black women die 42% more from breast cancer? Why are diabetes rates so high? And part of the problem is media. The way people talk about race and data and gender can lead people to believe that it's their fault. And that's because most people can't put it in the historical context. So what we do together is make sure that we provide the historical context for disease, for illness, for the delivery of care, because all of these things impact these terrible rates that we see. But it's important that people know it's not biology, it's not genetics, it's access. So you look at something like breast cancer in 1982, the rates between Black women and white women are exactly the same. Now Black women die 42% more. Simply reflects who got access to diagnostic care and early screening and who didn't.
So legislatively, what would you like to see done moving forward?
So legislatively, I'd like to see access expanded. The southern states need to expand the Affordable Care Act, which they haven't. We need Medicaid to cover births up to 1 year postpartum and cover moms and babies, because we see a lot of instances where women die within 4 or 5 weeks. We need to see reimbursement across the board tied to race and ethnicity and gender, and then we would actually see real improvements. We need to see the pipeline increase for providers of color. So there are things that could be done that aren't being done, but that's why we're working together to make sure that policymakers understand the implications of doing nothing as well as the implications of doing something.
Right, and you're definitely talking about, when you say working together, you working together with NCBW and getting the information out there and advocating on that part as well.
Couldn't ask for a better advocacy partner than NCBW.